My name is Brier Van Valin, and I'm an occupational therapist who works for Nursing and Therapy Services of Colorado. We're putting together a short video to discuss some tips on how to help your child tolerate wearing a face mask when they need to go back to school or go into the community. We'll also discuss different face masks that we have on hand that may be beneficial for you to know about and that might help your child tolerate wearing a face mask. So the first tip is education. It's important to tell your child why they need to wear a face mask. Tell them about the virus, that doctors recommend face masks right now to help protect their body and help protect others around them. It's also important to tell them that this isn't a long-term thing. They won't always have to wear face masks to school. They won't always have to wear face masks to the grocery stores. They won't always have to wear face masks to therapy appointments, but it's just right now to keep them safer and those around them. It's important to model wearing a face mask, and also it's important to model wearing the face mask correctly with it up over your nose versus down on below your nose. It's important to let your child explore the mask, so let them feel it, let them play with it, let them get used to it before putting it on them. Have family, friends, therapists model wearing the face mask to make it more normal. Also, you can put it on their favorite toy and have the toy model wearing that face mask. You can make it fun for them, make it into a game where they're playing doctor and they have to wear face masks, or playing ninja and you guys have to wear face masks. It's also important to pick a face mask that's soft and breathable. Avoid the rougher textures or the face masks that heat up or trap heat pretty readily. Have your child pick out a material or a face mask that they like. Pick out a material and make it with them. The material could be their favorite color, a sports team, a favorite animal. It's got a favorite print on it to make them more engaged in the mask, wearing the mask. If you guys are going with a disposable mask option, decorate it, put stickers on it, put googly eyes on it, draw on it with colors. You could even maybe use watercolors and let it dry, of course, before they put it on, just to make it more fun. Another suggestion is to have two different types of masks that are made of two different materials, maybe two different patterns or colors, and let them pick which one they want to wear. That puts them more in control of what they're putting on their face, which can also make it a little bit more fun for them. Another tip is practice. You want to make sure before school starts or you're having to go out to community that they've had time to adjust. They've been able to build up to being able to wear it for a certain amount of time. Make sure they're comfortable with it. So the steps for this would be: let them hold the mask, bring it near their face, stretch the elastic ear bands or the elastic ties, just play with it, make it fun. Independently have them bring it up to their face, or if they allow a caregiver to bring it up their face, and then take it away. And then once they tolerate that, put it on their face for short periods of time and set like a visual timer for them, so that way, okay, we're going to do it for 10 seconds this time. Once they're tolerating 10 seconds, do it for 30 seconds until they're tolerating an appropriate amount of time that they will be required to wear a face mask. It's important that you master each step before you move on to the next one. It's also important to use like a reward system, and whether it's clapping or cheering or getting to pick out a favorite pack of gum or watching a movie that they want to watch. But with that system, the reward system, pick a reward that isn't used every single day. So that way it's new for them and exciting, and they are motivated to keep practicing and trying to wear that mask. When they're in the community wearing the mask, you could provide a visual timer. So like, okay, we're gonna go to the grocery store, we're gonna be in here for 20 minutes. And you set the visual timer on your phone, and they can watch the timer go down and know that, okay, I only have 10 more minutes left that I have to wear this mask and tolerate it. The other tip is that safety is a must. So if your child has breathing problems, or they they drool a lot, they can't control their secretions, that it's important to pick, you know, a mask that is breathable, that they can tolerate, and that they can change it out readily if they need to. The other tip is, you know, if they are having a difficult time with breathing or they do have secretions, talk with their doctor and see if they have suggestions on, is it feasible for them to even wear a mask? What mask do they suggest to help keep the mask dry, or to increase the breathability on it? You don't want to put a mask on anyone under 2 years old, or anyone that cannot communicate to you that they need to take it off because they're having breathing problems, they're super uncomfortable, or anyone that cannot take it off themselves. If they cannot take it off themselves and they are able to communicate to a caregiver that I need this mask off, can you take it off for me, then, you know, that's okay, but you want to make sure they can communicate somehow or physically be able to take that mask off in case it's getting too wet, it's getting too bothersome, they can't breathe with it, you know, just to keep them a little bit safer. Okay, so I'm going to go over the masks with you. These are just a select variety. I'm sure there's a ton more masks out there that are coming available every day, but these are just the ones that I have my hands on right now. So this is the disposable type mask. It's just the papery blue ones. They've got the elastic earlobes. So you just put it on over each earlobe, pull it down, and then there is a metal band in it that you push down over the nose to kind of help fit it. I have found that a lot of my clients prefer these. I just think because they're lightweight, they're a little bit more breathable. I prefer them. I don't think they're as cumbersome as some of the other ones. We do have, you know, a mask that just slides over the head. It's almost like a neck warmer or a ski mask. You slide it over and then you bring it up. These are very breathable. You can see my mouth and my nose. I'm breathing pretty easily through it. The problem with them is that they do collect moisture pretty easily because they do touch my lips. So if I have anything wet in my lips, it's going to collect moisture, which is not what we want because it can collect bacteria. Another downside with these is that they do not have ear loops, so they may slide down, which means your child may be touching and fidgeting with their face a lot, which again, we do not want. We want them to try to keep their hands off their face as much as possible. This is more of a homemade style mask. It's got the elastic ear bands on it. It just again goes over the ears and nose. Should be underneath the chin and above the nose to protect their face from breathing in and out any viruses coming in. These are washable. I've seen them where they have ties on them, so they tie in the back, which may also be more comfortable for your child. The ear bands maybe they cannot tolerate it, so tie it in the back and you can tie it looser or tighter. Another option with the ear bands that I have seen is they have sewed buttons onto the hat, so that way they put it on and the earlobes sit on top of those buttons so they're not wrapped around the ears. This is another mask that is an option. Again, it's a pretty thin material. You slide it over their head again, and it's got ear loops on them. Let's see if I can find them. Oh, they're there. I put it on upside down. See if I can get this right. There we go. Okay, so it's got the ear loops on them. Of course, it goes over the ears, one on each side, and it comes up over your face like this. These are pretty breathable. Again, they're thin. When you breathe in, you just saw that it sucks into my face, which can be a problem with collecting moisture. You know, especially if you've got a child that has a drooling problem, and or they're not able to tell if the mask is wet and it needs to be changed. That could be an issue. But I know some clients really like these because they are lightweight. They aren't as cumbersome. They're super soft. You know, doesn't rub the face raw at all. Like the disposable masks, sometimes they can be rough and they can make your face itchy. They can also cause skin breakouts and irritation. This one is a lot softer. Let's see what else I have. I think these are just more examples of homemade masks. They just have different materials on them. This one's a softer material. This pink one is, you know, it's softer on the outside, but it does have another layer of protection on the inside, which is a little bit rougher. There are homemade masks that people are making. I think you can get them at the stores too, but you can buy another protective insert that slides in here, and this acts as like a filter to help reduce the amount of inhalants that you're breathing in or breathing out. This is another type of mask. This one, I mean, I think this one kind of looks kind of cool. So, you know, some people may be really into this because it's, I don't know, it looks kind of like you're from a video game or a superheroes movie. But it's, again, it's got, you know, kind of a rougher material on the inside. It, again, has the filters on, you know, both sides that you can replace. It's got a metal band on the top so you can pinch it down on your nose. This one also has a Velcro strap that just goes around your back, the back of the head. It doesn't go on the ears. It doesn't tie, so this might be more doable for some clients. This one, I think it's a little bit more uncomfortable for me. I don't like the way it presses on my nose, but it's also not fitted for me. But that is an option for you guys. You know, most of these you guys can, you know, find on Amazon or at groceries, not grocery stores, but like those little mom and pop shops. But those are just a couple of options. There's a lot more out there, you know, that you guys could pick from. A lot of it's going to be trial and error. See what your child can tolerate and what they can't tolerate. You know, if you know what kind of clothing material they like, look for a mask that's similar to that clothing material to see if they prefer it. So that's just a few suggestions. If you have any additional questions or concerns, you're more than welcome to contact me at Nursing and Therapy Services of Colorado. Our phone number is 719-574-5562, extension 239. You can also contact me at my email, which is brier.vanvalin, V as in boy, R-I-E-R, .V as in Victor, A-N, another V-A-L-I-N, at ntsoc.com. You know, also feel free to reach out if your child has an occupational therapist. Reach out to them to see if they have suggestions on how to make it more user-friendly for your child. If you don't, please contact us because we'd be happy to do an evaluation to see what we can do to help make this progress a little bit easier, or process a little bit easier for your child. Thank you for your time, and I hope we hear